Imaging procedures in children is probably far more important than it would be in the adult world. An adult can tell you, I have a headache, I have a fever, my stomach hurts, it only hurts 2 days a week, where children can't verbalize that. Children get frightened easily, and this is a new area for them. So, and of course they're always thinking about, am I going to get a shot, is this going to hurt, whatever. So we go to great lengths to really tell the child what we're going to do. We have little dolls that we show them, this is how we actually take a picture, and this is what we do, and this is what we have you drink. We might actually have them help mix Kool-Aid and different types of things they may be drinking for a procedure, just to help allay their fears a little bit, make them more comfortable with the imaging procedure. We put decorations and decals on our CAT scanner, our nuclear scanner, 2 of our x-ray rooms, bright colors, animals, and happy scenes, just to kind of give kids a little bit more feeling of a comfort level and allowing us to take better pictures. If a child is distracted by looking at all the different colors and brights and shapes of animals and things, then they're a little bit more comfortable with us, then we can get a better exam. Radiation dose is accumulative, so whatever you get as a child, it just keeps adding up as you get older, so we want to use the lowest dose possible for everything possible in children. Still see a good image, but it's the lowest possible dose we could use to get that image. And I think in the adult world we wouldn't be doing that. I know that we wouldn't be doing that. In the children's world, we really, that's how we live and breathe, is by imaging gently and just doing the right dose and the right picture and getting the right exam.
Well, we're here today for a CT scan of Duncan's sinuses. He's had some really chronic congestion and coughing. So we're going to have a look and see what's going on in there. And the pirate room was pretty cool. Mm-hmm. The room was painted completely like a pirate setup, including the floor. The floor was like the dock with the water on the sides, and animals and things on the walls. And the CT scanner itself was like the wheel of a pirate ship. It's, for a child, it can be kind of scary. You see things that make noise and it look very institutional, and this is, you're not even really thinking about the fact that you're doing a procedure. Very, very welcoming, very whimsical and fun.
We were sedating a lot of our children to keep them still while we were imaging them, so there wasn't motion on the images. And we found out that maybe if we could distract them long enough, we could get them through the scan without sedation. And although sedation is done very safely here at Children's, it still has some risk to it, and we wanted to reduce that risk. So in the hospital in Oakland, we started in our CT scanner, and we were able to take simple things like murals on the wall, disco balls, projecting images on the ceiling, and change the atmosphere from being so medical in CT to almost being an underwater sea adventure with mermaids and fish. And it worked. We found out we were able to reduce sedations in that CT scanner by about 90%. And after we realized how successful this was, it was during the time we were getting ready to come to the new hospital. We decided that we could make this so much better with the opportunity of new rooms and new scanners and new equipment. So we began to partner with GE, and we came up with what's now known as the Adventure Series.
My name's Stephen Jones, and I'm a nurse at Children's Hospital in Pittsburgh, here in the radiology department, and exactly in my favorite room, which is the Pirate Room, that we've designed with GE, and it's themed to help the children, get through the scans, feel a little bit more comfortable, to feel like it's not so medical, more friendly, and that way we can use that atmosphere to warm them up, get them into the scanner, and then from that point to complete the exam. Maybe like 6 or 7 years ago, it would be a plain old scanner with no decorations at all, and kids who look at that machine as being something very scary, and I would just look at my coworkers for little things that they would do to help the kids get through those scans. Everything from pretending that they were at a hair salon getting their hair washed to painting their nails, imagination that we're going somewhere, some things like that. And then we decided as a group to go ahead and decorate the scanners, and that seemed to be a large a great step in the right direction. And so we just continued with that train of thought and added some massage therapy, rocking the scanners, putting the parents up on the scanners with the kids, making it more fun, storytelling and things like that. Then we started working with GE, and then we actually themed out some of the rooms to be a story. So in many situations, I will be in a room preparing the child to come into the scanner, and I'll start talking about the pirate adventure, actually giving the kid a pirate hat to wear, getting them to usually get on board with me, going, "Arr," you're like, "What does a pirate say?" And they're like, "Arr." And so we'll just run down the hallway together to get on the pirate ship. And then once we do, it's usually pretty easy to get them through the scan. A lot of the doctor's offices take a while to realize that, this kid doesn't need sedation. They'll be just fine doing this test because we work with the kids that well. And so they're surprised. And over the years, it's kind of funny that they've caught on to it. They're like, "Oh no, you'll do fine at Children's." They don't even order sedation anymore because they know you'll be just fine. You're going to Children's, and that's going to be great because you're going to have a good experience there.
Big camera spinning around. Ooh.
Stay still, Penny.
Yeah, I'll show this video to Goonie so he knows what it's all about. Oh, going around again. Got our Leo down there. Okay.
All right.
Hey, and now we've got a picture.
You can open your mouth now.
Okay. Awesome job, Squirrel.
Don't hit the... All right.
Let's talk about radiation doses. What we do in a children's hospital is we focus on the patient's size and weight. The smaller the child, the lower the dose. If you go to an adult hospital, you're going to get the standard adult dose in most cases. So, do you want to take that risk? It's your choice.